Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to discuss the prescription medication Divalproex, also known as Depakote, which is a prescription anti-epileptic medication that was approved by the FDA in 1983. This medication was initially approved for the treatment of seizures associated with epilepsy, including focal impaired awareness seizure and absence seizure. A focal impaired awareness seizure, also known as a complex partial seizure, affects just one part of your brain. During this seizure, a person may appear confused, dazed, or having unusual behaviors such as lip smacking or repetitive movements. They may also not remember the seizure afterward. On the other hand, an absence seizure involves brief periods of unconsciousness where someone may seem to stare blankly into space. They may also stop moving or talking suddenly, and the seizure usually lasts only a few seconds. Afterward, the person might not even realize they had a seizure. Over time, Divalproex approved uses expanded to include bipolar disorders such as manic episodes or mixed episodes, as well as migraine prevention or prophylaxis. Now let's discuss how this medication works and its mechanism of action. Divalproex works in your brain to help control seizures and stabilize mood in conditions such as bipolar disorder. It does this by increasing the levels of a chemical messenger called GABA in your brain. GABA helps to calm down nerve activity. Divalproex also decreases the activity of another chemical called glutamate, which is involved in exciting nerve cells. By balancing these chemicals, Divalproex helps to prevent abnormal electrical activity in your brain that can cause seizures or mood swings. Let's move on to dosing. Divalproex is available in both capsule form in 125 mg strength as well as tablet form in 125 mg, 250 mg, as well as 500 mg strength. If you miss a dose, take it as soon as you remember. But if it's almost time for your next dose, then skip the forgotten dose and take your next dose at the regular scheduled time. It is not recommended to double up your doses. Keep in mind that if you're considering discontinuing treatment, it is important to discuss this with your doctor first. Abruptly discontinuing Divalproex, especially if you have a history of seizures, can significantly increase your risk of experiencing uncontrolled seizures. Your healthcare provider can assist you in safely discontinuing this medication by gradually reducing your dose over time. And like all medications, Divalproex has a few side effects. Some common side effects may include nausea, vomiting, dizziness, drowsiness, tremors, weight gain, hair loss, weight loss, blurry or double vision, body aches, cough, and other flu-like symptoms, fatigue, abdominal pain, constipation, changes in menstrual periods, or fever. If you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. Divalproex can cause some serious side effects. It is important to be aware of these potential risks and to receive medical attention immediately if any serious side effects occur, including extremely high blood ammonia levels. Symptoms of this may include fatigue, poor mental alertness, or vomiting. Drop in body temperature. Symptoms of this may include shivering, feeling tired, feeling confused, slurred speech, and coma. Signs of liver problems such as yellowing of the skin or eyes, dark urine, persistent nausea or vomiting, or light-colored stool. Signs of pancreatitis such as severe stomach pain, nausea, or vomiting. Suicidal thoughts or behavior. Uncontrolled movements, including tremors or jerking movements. Severe allergic reactions, including swelling of your face, lips, tongue, or throat. It is important to note that serious side effects of this medication are relatively rare and most patients tolerate this medication well. However, as mentioned, if any concerning symptoms occur while taking this medication, it is important to receive medical attention immediately. Divalproex has the potential to interact with numerous medications, including blood thinners such as warfarin, over-the-counter medications such as aspirin, and anticonvulsants such as carbamazepine or phenytoin. So before starting treatment with Divalproex, make sure to inform your doctor about all medications. Avoid starting any new medications while taking Divalproex without speaking with your provider or pharmacist first, as they will assess the safety of all medications for you. Keep in mind that drinking alcohol while taking Divalproex can increase your risk of drowsiness and dizziness. To briefly summarize what we discussed today, Divalproex, also known as Depakote, is an FDA-approved prescription anti-epileptic medication since 1983. This medication was initially intended for treating epilepsy-associated seizures such as focal impaired awareness seizure and absence seizure. Its application has expanded over time to include bipolar disorder and migraine prevention. So focal impaired awareness seizure, as discussed, affects one part of the brain, resulting in confusion or repetitive behaviors, while absence seizure include brief unconsciousness. Divalproex can help by enhancing GABA levels, which calm nerve activity, and reducing glutamate activity, which excites nerve cells, thereby preventing abnormal brain electrical activity. It's available in capsule and tablet form. Dosing should be consistent and missed doses should be taken right away as soon as you remember without doubling up. If you're considering discontinuing this medication, it is important to speak with your doctor first to avoid increasing seizure risk, especially if you have a history of seizures, as abrupt discontinuation can exacerbate this risk. And some common side effects include nausea, dizziness, and weight changes, while severe side effects may include liver problems and allergic reactions, although these are relatively uncommon. Divalproex may interact with various medications, requiring full disclosure of all current medications with your doctor or pharmacist and avoidance of alcohol consumption during treatment. You can read more about seizures on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comment section below. And don't forget to subscribe. Bye for now.